Anyone? I mean, it's just $250 million. I mean, what's that between friends, right? Anyone? Any data? No?
Thank you, Ms. Rempel Garner.
Dr. Pirzada, thank you so much for taking time to be here today and for your service in our community. You might not realize this, but you've actually had an impact on me and my role as the Vice Chair of the Health Committee since I was appointed last fall. Since the pandemic started, I've always been of the opinion that in order to reduce the larger societal impacts of lockdown, that we should be looking at ways to undertake more targeted isolation measures supported by rapid testing so that we can prevent the spread of COVID, but also reduce, the harm of domestic violence, suicide rates, mental health, surgeries being canceled, all the stuff I'm sure you're seeing. You wrote an article in the fall talking about the need to have rapid test deployment. And here we are, we're like 6 months later. We're on track to have, I think it's less than 10% vaccinated by the end of March. Do you think it's time that we need a federal strategy on rapid testing deployment?
Oh, definitely. This is an underused technology, and many, like Slovakia and other countries, have used it to lower burden. And, baby steps have started in Ontario on rapid testing. But I think, we bought 20 million of these tests, but we need 10 to 20 million of these tests every week. If we can get everyone testing quickly, 2-3 times a week, we can really bring down the numbers and make things like opening schools a lot safer. So I think this should be definitely a priority for the government.
Well, I'm half Slovak, and I met with their ambassador on it, and I know it's been going very well there. I've heard everything from the federal government, from rapid testing isn't a panacea, it won't work, to it's not our responsibility, we've bought the things for the provincial government, they're not deployed. I think Canadians are starting to get tired of the finger pointing across jurisdiction. How could given our jurisdictional boundaries, how could the federal government take a more active role or provide more value add in deploying a test like this, especially knowing that vaccinating everyone is probably another 6 months away at very best?
So I would say licensed manufacture here. There's a great company in Halifax, Sona Nanotech, that makes them. We can make them here. We could license it from Abbott as well. But, we need tens of millions of these tests every month. We need lots of them. Get them in the schools, get them at the workplaces that keep having outbreaks. We know that they'll work with the variants as well. So that's a great strategy if we can get them out there, approve more of them. There's some tests that are approved in Europe that aren't approved here yet. Just get them out there and get them to work.
Yeah, I mean, I listened to the Chief Public Health Officer on Friday, and she, made a statement that it was unlikely that Canadians were all going to be vaccinated this year. But she also presented some projections on the spread of the variant. And on Friday, we had officials from PHAC here talking about what the modeling included and didn't. And I was really surprised that they weren't able to speak to assumptions around rapid testing and vaccination in future models. Do you think rapid testing, if we had a national strategy, it could help us prevent the spread of the variant?
I think it's something to be considered, but with the variant, it's way more contagious. So airborne spread, just look at the building outbreak in Mississauga. It did not happen, people in close contact with each other. They were in vestibules, maybe in elevators. So anything needs to be done to stop the spread of that. So it's something that will really help, I think. But along with other things like fixing ventilation, getting people to wear improved masks as well. So those are all important things.
Oh, great. If you want to table some recommendations that are further on that to this committee, we would love to have them. I guess the other thing that I took away from some of your writings and your testimony here today, and frankly, as a policymaker who, I have people calling in my office and saying, when is this going to end? I think that the general theme of the last year and a half has been a lot of inertia within our bureaucracy and not a lot of direct input, either from people who are, dealing with this on a daily basis through lived experience or from frontline medical workers. If there were 3 things or more that the federal government could do today to have more input from folks like yourselves to overcome this inertia, what would that be?
So I think get us here more often. There's lots of people like me out there who have a lot of good observations. The medical community really wants to talk to you guys and get our viewpoints. Second thing right now is just tell the public to really look out for airborne spread of this virus. Where N95s are easy to find now. Lots of Canadian companies are making them. We've got a great list online if you can search for it. The third thing I would say is really listen to the science and try to get ahead of this. We know Europe has given us a great head start, and just follow what they're doing that works, and really think about single dose vaccination like what the UK is doing. I think they're going to be the first out of this first, I think.
Thank you. With the time I have remaining, to Dr. Bernstein, when you were on the vaccination task force, and I know you sit on there now, did you recommend that the government enter into the CanSino agreement?
Well, the CanSino collaboration between the NRC and CanSino actually started before the vaccine task force was formed. So when they came in front of us, it was partly an FYI, but partly for us to comment on the science behind.
And what was your comment?
Our comment was that there was two things. There was sort of good news and bad news. The good news was that at that point, CanSino was actually way out in front of any vaccine developer in terms of having a vaccine for human use for COVID-19.
And the bad?
So the bad news was the science into it. I can go as deep as you'd like into it, but because it was an adenovector, and we all have antibodies to the adeno5 vector that was used in the CanSino vaccine, that there was a worry that there would be antibodies that we would naturally have already been making to the vector itself, to the vaccine itself. And so there was a question of how effective that vaccine would be. And so we provided that information back to them. When we saw the later data later on in the summer, we then recommended that the collaboration end.
Thank you, Ms. Rempel Garner.
Can the Prime Minister tell Canadians if he's expecting a reduced or zero shipment from Moderna on the week of February 22nd?
It was going to be a massive challenge for companies around the world to develop and produce a vaccine that didn't exist yet when we were signing these contracts last summer. That's why we signed so many different contracts for so many potential doses for Canadians to ensure that we would be able to get Canadians vaccinated regardless of challenges or, yes, fluctuations in the week-to-week delivery program.